We're now moving to Sarah Gerritsen from the University of Auckland to talk about the infant and toddler dietary guidelines, the update there. Do we have Sarah? Oh, yes, there you are. Thank you, Sarah.
I'll put my timer on because I don't want to go over. But tēnā koutou, tēnā koutou, tēnā koutou katoa. So, ko Sarah Gerritsen toko ingoa, he senior researcher aho e te whare wānanga o Tamaki Makaurau. So I'm Sarah Gerritsen. I work at the School of Population Health, the University of Auckland. Thank you very much to Hiringa, Hauora and ANA for inviting me to talk to you today about infant and toddler nutrition. So a bit of a change from the rest of the program around sleep, but so interrelated. In 2019, Dr. Sally Mackay and I were contracted by the Ministry of Health to revise and update the maternal, so for pregnant and breastfeeding women, and infant and toddler dietary guidelines. The new maternal guidelines were released last December, so I'll give you the link to that at the end of the slide. And those sit within the adult eating and activity guidelines, recognising that mothers' maternal nutrition is so important even before conception, that we need to be starting to think about how do we have healthy young women right from an early age before they even reach the time they're pregnant. And then the infant and toddler dietary guidelines are supposed to come out in the next couple of months. It would have been nice to launch them here today, but never mind. Next time we meet, hopefully we'll be able to share those. But I am going to talk to them today anyway, because, you know, may as well get the messages out there. The current guidelines, I'll click, are the ones up here, which were written in 2008. And they sit in quite a detailed document. They're called a background paper. And there's also this very old looking now health education resource produced at the same time. And since then, there's just been this rapid increase in the amount of research on the first 1,000 days of life, what we know around nutrition in this period. And so they really did need an update. And I think the other main thing there's been is this recognition, or at least more recognition, of around the social determinants of nutrition and health outcomes. So that poverty, abuse, you know, stress and addiction, these all play into what people are eating and what they choose to eat. And the complexity of parents' lives around this period for feeding babies is really important for us to consider as well. And it makes it difficult for some whānau to provide the nutrition that they'd like for their children in this important period. So I think the main point of the dietary guidelines is to enable health professionals to provide confident, consistent, and evidence-based advice. Okay, so there's this definition here that I found around food-based dietary guidelines. It's kind of an international practice now that countries produce these. They're this attempt to translate a really large body of research, a vast and always incomplete. That's kind of important, but actually we don't have all the answers, but this is where we're at this point in time with evidence regarding the relationship between food and health outcomes. So the big bit for us in New Zealand, though, in Aotearoa, when we were thinking through these guidelines, was how do we make them culturally appropriate, though, and actionable? So things that people can actually do. You know, we're not setting the bar too crazy high. And the picture up there was just to remind me to say, you know, we live in a world where you can Google anything, and people are Googling how should I be feeding my baby? What's the best age at which to introduce foods? And we need to make sure that what they're first getting up in those searches is actually evidence-based and makes sense to them and will reach them. I am going to, you know, me to you. Albany spoke about conventional research, and here it is. Like, this is the epitome of conventional research, which is what the dietary guidelines is based on. So I'm not going to shy away from the fact that this is totally white science here. this idea of being evidence-based really originates from evidence-based medicine, and this idea that you can create a clinical guideline which is going to give you best practice. So they are systematically developed statements that draw on this hierarchy of evidence in the triangle there. So what we've privileged with them, I don't know if I can make the, oh no, I can't, sorry, stuffed it up. What we privilege is what's at the top of the triangle in this model. So the systematic reviews where they've searched the literature to find the answer to quite a specific question usually, and that question, who informs the question, is also a really important thing for us to consider here. So the dietary based guidelines do privilege this model, and we're really, it's a little bit different in that we're trying, instead of trying to get something for a clinical outcome, you're trying to get statements that will work for a broad population base. So but they are still based on these systematic reviews and critical analyses of the literature that's out there, the academic literature. So the circle is around the bits that we privileged when writing the guidelines. But I did kind of want to point out that we do use lower forms of evidence, and I really put these should be a double thing here when we were doing it, because we can learn a lot from other forms of evidence, obviously. So we have got randomized control trials in there too, which some people might go, oh, well, that's not that lower form. But we looked a lot at the Growing Up in New Zealand data as well, our largest cohort study in New Zealand around what are the current practices. And we drew a lot on expert opinion, that bottom form, but actually that's what is in some ways the larger base that holds up the dietary guidelines. And we had a maternal and infant and toddler reference group, or TAG, they were called, Technical Advisory Group, set up by the Ministry of Health. And these women met a lot throughout the guideline development to feed into this process of reflecting on what we were seeing through the systematic reviews and the international evidence of, well, how does that fit with our practice and our knowledge? Professor Claire Wall was the chair of the group, and then we had other academics and people working in this infant nutrition space to really feed into it. I don't have a picture of Anne Hodron, sorry, the Plunkett national educator, but she was on the group as well. Then I got a lovely photo of you guys because Moana Research led our testing of the dietary statements with parents themselves. So before these went out to the general public, we did test them pretty well. They talked to 53 mothers, pregnant women, fathers, grandparents, caregivers, and early childhood education providers around, did these resonate with them? Were they going, you know, did they seem sensible to them? What were their feedback on it across all, lots of different ethnicities there. And then we did an online stakeholder consultation as well. And this is the largest consultation done on dietary guidelines so far in New Zealand, where we had over 40 organisations and 32 individual submissions as well on the wording that was in the statements. We took that all into account. But what I really want to get onto today is talking to you about what's new in these guidelines. So helping with a bit of the interpretation, because the big role now is actually for us collectively to start spreading these and changing them into something that's going to resonate with our families, because certainly the book that the Ministry of Health produces isn't going to be it. That's helpful perhaps to a few health professionals who pick it up, but we're then going to have to work on the resources that flow on from that. So how the book's written is there is 6 chapters, which are a lot more condensed than the previous guidelines. They're really focused in on short, sharp, quite actionable statements so that they're easy to pick up and use with families. The first bit's around breastfeeding, then around introduction to solids, then around the 4 main food groups, so echoing what's in the eating and activity guidelines, the new ones. And And then 3 chapters which were kind of newish around the no, low salt and sugar messaging. One specifically on drinks, because we know that's a bit of an issue. And then the last one on developing healthy eating behaviours for life. So setting the child up with, ways how we eat being more emphasised. And I would say that the main difference between this updated version and the 2008 ones is really around the emphasis of what we're interested in. So the last ones were like, introduce this food at this age group. Now we've put the emphasis in a different place, which is around responsive feeding, sorry. So looking for cues from your baby, that type of thing. And also in the confidence of these statements, I feel like a lot of the stuff that was written in 2008 was kind of, this may help, we have some ideas that, eating in this particular way might be useful for babies, but actually now there's a lot more confidence with a greater body of research sitting behind a lot of these statements. And where we're not sure, we've put that in quite clearly this time. But where we are confident, we should actually be confident, because mothers deserve to know what is the best evidence out there at the moment around how to feed their babies. And we wanted to be clear in that, really. Okay, so the first statement around breastfeeding is that aim to exclusively breastfeed your baby to around 6 months of age. Continue to breastfeed alongside the introduction of complementary foods at around 6 months, and for up to 2 years or longer. So this brings New Zealand in line with the WHO, the World Health Organization's recommendations around breastfeeding to 2 years and beyond. And the evidence around extended breastfeeding is really getting stronger. But where we know the emphasis needs to be put in New Zealand is actually around our exclusive breastfeeding rates. We know this from growing up in New Zealand, that a lot of our children are still not getting to that, past 3 months, 4 months of breastfeeding. So we're sharing with parents that if you choose to breastfeed beyond a year, that's actually really beneficial for your health. That's that bit at the bottom there. Mother's health is, they're pretty confident now in the literature that beyond 1 year of breastfeeding decreases mothers' risks of breast cancer, ovarian cancer, and diabetes. And the first bullet there is that it also beyond 6 months is really good for the baby. So this introduction of complementary foods maintains the correct energy balance for babies, and also their nutrient intake, and reduces the risk of allergies. And that's where the evidence has got a lot stronger too. Number 2. The second guideline is introducing complementary foods at around 6 months of age when your baby's showing signs of readiness, and we're getting clear on what those signs are as well. The readiness is often internal with babies, though, that actually it's when their digestive system's ready. So it's actually that stressing, the emphasis now is that on around 6 months of age, actually. And offering iron-rich foods, vegetables and fruit to infants as first foods. Introducing a range of tastes and textures earlier rather than later. And this is a change in from the previous guidelines, which had kind of delayed introduction actually around for a lot of foods, whereas now we're like, once you've started solids, quickly get a whole range of foods and textures into babies. So there's faster texture and taste progression than previously advised. Start with spoon-fed purees, particularly if they're younger, obviously, before the 6 months, and then progress quickly to chewable textures, such as mashed lumpy foods and finger foods. That's some wording there. We know that 1/3 of infants in New Zealand are introduced to solids before 5 months of age, so not meeting this guideline. And really the emphasis is on bringing that figure down. Statement 3, so once the complementary feeding started, offer a range of nutritious foods from the 4 food groups. So this is actually new. The previous guidelines didn't have much around the 4 food groups, or this idea that an infant or toddler would be moved. It did say work towards a family diet after 1 year of age, but they didn't have a lot emphasizing this, whereas now the emphasis is on actually make sure you're including the 4 food groups once solids have been established. Bringing into line with the adult eating and activity guidelines around vegetarian diets are appropriate for all age groups, including infants. Just need to be aware for vegan babies about the B12 and checking weight, etc., the usuals that we would do. But there's not like a special chapter for vegetarian kids now, because the eating and activity guidelines are actually trying to move the whole population towards a more sustainable diet. Then this introducing common allergy foods early is quite clear in these new guidelines before 1 year of age, but even earlier. So there's no delay, wait till for fish till after 9 months, I think it used to say, or anything like that. You can actually introduce common allergies right from when you introduce solids. Acknowledging that you would start with iron-rich foods though, and the fruits and vegetables first. But once those are underway, certainly the other allergens, it's good to get in. What else? The statement 4, so we're up to the low, no salt and sugar. So this one is about when preparing foods for your baby yourself, don't include salt and sugar in the preparations. And then if using commercially prepared foods, choose those that are low in salt and sugar. Oh, and with no added sugars as well. So this is stronger wording than was in the previous guidelines, which is kind of avoid high salt, high sugar foods, and really builds on the knowledge we have about what our infants are eating. In the growing up in New Zealand study, we had half of infants had tried sweets, chocolates, hot chips and crisps by 9 months. And that's not surprising really, because they're just eating what's there, right, in their environment. So we need to say, actually, it's important to delay the introduction of these foods, because as soon as they do have high salt, high sugar foods, they want them. They taste great, right? So we want to try to get the taste and flavor preferences set before. And the baby, when they're first introduced to solids, is so excited by new flavors that you don't want them overwhelmed by salt and sugar, and that's the only thing that they want then from then on. So delay. And we've also got a list there of foods that are not good options because they have poor nutritional value and displace healthy foods in the diet. So trying to be clearer to parents around what we know actually works in this space, and talking about, you know, it might be easy not to have these foods in your home, or think about how you're going to have a different option for your infant or toddler when you're giving these foods to other people in the family. The drinks statement is recommending, so this is a bit clearer too, around breast milk or water for babies under 12 months, and the water only once they've started solid foods. Cow's milk can be offered as a drink after 12 months of age, and so no need to continue with formula. If you're on that, you can switch to cow's milk from 12 months. And don't give your baby toddler juice. Oh, I think that's supposed to say milk. Oh, don't give your baby or toddler, getting stuck, juice, cordials, fruit drinks, flavoured milks, soft drinks, tea, coffee, alcohol. And what's missing from that list is toddler milk, which is what I was thrown by, but it also has quite a clear statement around no toddler milks as well. So yeah, much stronger wording with this, and also trying to move to developmentally appropriate ways of giving drinks to babies. So you can actually use cups. You don't need to use the spouts, and certainly not the sucky ones early. So this will help babies, but you know, there's got to be a practical element in there too. Obviously, sometimes when out and about, mums will want to use a spout, but yeah, to try to encourage children to start bringing cups up to their mouth and using them. So in this chapter, we've now covered raw milk, plant-based milks, toddler milks, limiting cow's milk, safe drinking water, and oral health. So there's quite a lot packed in there, but these were key messages that really are not well known. It's quite interesting. You'll still get quite intelligent people saying, oh yeah, but raw milk's great for babies, isn't it? So, you know, we need to have some clear messaging in New Zealand around this. It's not safe. We now know that. We've got good evidence that it's not safe. Same with plant-based milks before 12 months of age. There's just not enough it's not nutrient dense enough for them. They're going to start losing weight on them. The toddler milks, yeah, there's a whole bit on why we shouldn't be supporting toddler milks in New Zealand. And the other ones I've talked to. So statement 6, I'm racing through this because I don't want to spend too long on it. This one is really speaking to the theme of this conference. So the Manaaki Tamariki, fostering a way of feeding infants that recognises their mana and is also mana enhancing for the parents. So being able to, you know, be responsive to your baby and what they're telling you. We know that there are a lot of families in New Zealand who, and quite largely Pākehā families probably, who use quite a directive approach to feeding their children, and this is not helpful. We know that now quite strongly in the research that you need to be responsive. You need to let your baby guide you, which is what the wording says, and encourage your child to eat, but don't force them to eat. And also sitting with your baby while they're eating, so not leaving them in a high chair and giving them something but walking away, or at least watching them, but actually sit with them at the table. Aiming for relaxed, enjoyable meal times. It sounds lovely, doesn't it? But we all know that's quite difficult to attain. But that's what we're aiming for, without distractions from TV or other screens. And then from a young age, encourage your child to feed themselves. Okay, trying to get starting with just spoons, everything in. They can do it themselves from an early age, and helping with meal times. So there's this emphasis now on responsive feeding in the guidelines and adult role modelling. And the whole point is really about setting up healthy eating behaviours for life. So where can you get them from? Well, as I said, the maternal guidelines, which I didn't actually speak to today, but that's around nutrition for breastfeeding and pregnant women. That's available in the eating and activity guidelines on the Ministry of Health's website. And then these dietary guidelines for infants and toddlers will be released. They say June, July. I haven't seen a formatted version yet, so I'm starting to feel nervous about saying that, but hopefully that's coming very soon. Yeah, COVID was a real blow to the release of the infant and toddler guidelines because their main person left the ministry, got seconded. So we're just trying to work through a revised edition now. So in summary, the dietary guidelines aim to provide kind of clear population level guidance and on the collective kind of wisdom about what to eat and drink for healthy growth and development. But feeding infants and toddlers is not easy. And this is my daughter, Elise, telling me what she thinks of the food I've given her. I think parents and whānau, need a lot of support around this area, and we haven't really been supplying the best available evidence to date in this area to them. And so the support we need is not just educational, it's financial and it's practical and lessening the stress. So I think it's up to us all collectively now to ensure that parents are getting that support, right? And that we can also provide them with this best available evidence. But the end goal is really that we have all children in Aotearoa learning how and what to eat, right? So that they develop a healthy relationship with food for life, thereby creating the platform for equitable health outcomes. Without nutrition in the picture, there are no equitable health outcomes. So I am really keen to see these messages spread far and wide, but in an appropriate way. And this is not an appropriate way yet. So it's a little bit of a handing over the mantle now from us academics to you guys who can actually make the difference here and make sure that these messages get out to the communities in a way that's going to work. So I'm looking forward to seeing innovative, strengths-based kind of resources that come out from this. And Jacinta's kōrero about, thinking around how we translate this knowledge into a way that really reaches our families kind of resonated with me. Anyway, nō reira, e te whānau, thank you. Tēnā koutou, tēnā koutou, tēnā koutou katoa.